It's been said that one test of a nation's morality is the way in which it treats its children. Well, here's a jarring statistic. 9 million children in this country do not have health insurance. Most of these kids are from working families, and this is happening in the richest nation on the planet. So tonight we shine a spotlight on uncovered children, their families, their struggles, and the ways in which you are paying for this crisis. The Willinghams, the Andersons, the Urs, the Tonys. If the 9 million children without health insurance in this country held hands, they would easily stretch from coast to coast. Brenda Tinch and her husband have to find money every month for their children's asthma medication, ignoring bills or borrowing from their family or their church.
Without being able to provide for my kids, it's a helpless feeling.
That's how Akia Anderson feels too. Her daughter has a bone disease and needs an orthopedist, which she can't afford.
That's my baby. And I can't do what I need to do for her. I can't do what I need to do for her, so I feel helpless and hopeless.
Both these families work, but they earn too much to qualify for Medicaid and too little to afford private insurance.
If you judged a country by how it treats its most vulnerable people, we're certainly failing when we leave 9 million children behind.
It's a national disgrace. It also not only costs lives of children and stress for families, but it also costs taxpayers money.
Here's how it costs taxpayers money. When Carol Martin's son, Simon, had an infected toe, she couldn't afford to take him to the doctor. She cut a hole in his shoe and hoped it would get better, but it got worse.
Sometimes I'll almost cry, really.
Putting your shoe on, you would almost cry? After 5 months fighting red tape, she finally got government insurance for her son, but by then his foot required expensive surgery, a bill taxpayers swallowed.
I'm not looking for a handout. I just need assistance. Health care. That's all.
When uninsured children do get medical care, that care is often inferior. One study says an uninsured child is twice as likely to die when hospitalized. Even when a child is covered by government insurance, he or she can fall through the cracks, like Diamante Driver. His mother couldn't find a single dentist who would accept Medicaid. An abscessed tooth became a brain infection. Emergency treatment cost $250,000, but it was too late.
My son had to die at 12 years old because of a tooth.
We need to just look at the realities of people's lives, of workers' lives, and then say, how do we fix this? Because it's not working.
Mike Levitt is the Secretary of Health and Human Services. How do you explain that we have 9 million kids in this country, one of the wealthiest countries on the planet, who don't have health insurance?
There is a widely held aspiration that we change that.
The argument's been made that you can judge a society on how it treats its most vulnerable members.
They need health insurance. Every person in this country needs to have access to a basic insurance policy at an affordable price.
So what's being done about it?
Well, there's a lot of talk about it, but thus far we have not achieved it. I think a moment is coming where we may see significant progress.
If and when that moment comes, it will be too late for this child, Devonte Johnson. He lost his insurance coverage while in the middle of fighting kidney cancer.
He was my little angel from God. Sent here, he was only sent here for a season, but the season he was here, he did well, and I'm just honored to be his mother.
As Devonte's mother tried to make sure her child was covered by government health insurance, she says she ran into a blizzard of red tape. Many child advocates believe government officials deliberately make it harder to enroll a child in insurance programs as a way to save money. We're going to get into that next week. And our reporting on this issue continues on our website, abcnews.com. There you can post your comments and share your stories with us. We hope to use those stories on the air.